People think of your core as just your abs, but if you think
Mhm.
of like a soda can, that whole thing is a canister, right? Our core kind of looks the same way. It's a canister. And so it's not just your abs on the front, your pelvic floor from the bottom is included in that. So when we talk about the pelvic floor, we really just mean that bundle of muscles, but pelvic floor PTs and pelvic health in general encompasses a lot more than just the pelvic floor muscles.
That would explain why sometimes you have pain in other places, and then when you go to a PT, you're like, "Oh, that solved that problem." I didn't know that.
Anybody who's been in PT knows that where the pain is not always where the problem is. Yeah, exactly.
It's never where the pain is never where the problem is. This is NICU Babies Parent Support with Kathryn Whitaker, a podcast from Hand to Hold, a national nonprofit that provides free personalized support, resources, and community before, during, and after a NICU stay. My conversations here focus on education and personal stories with medical and hospital professionals, counselors, therapists, and NICU moms and dads from across the country. So whether you're preparing for a NICU stay, you're currently there, or you're months and years past your stay, you belong here. The NICU is hard. We're here to help. I'm your host, Kathryn Whitaker, the mom of 6 children, including my very own NICU baby, and I'm so grateful that you're here. Howdy, y'all. Welcome back to the podcast. You know, these last 3 episodes here in this particular series and season on the podcast really tie together so beautifully, and we're going to kick it off today. A lot of times, ladies, we tend to put ourselves last, shall I say. We tend to everyone else. We tend to our spouses, partners, children, houses, friends, and somehow we get pushed to the bottom of the list. These next 3 episodes are really focused on how you can take better care of yourself, your body, your health, and how that can really help you serve not just your family, but your NICU baby in such a beautiful way because you're taking care of the person that gave birth to that baby. So I really am excited about these next 3 episodes. So we're going to focus first on pelvic floor and the health of your pelvic floor. Then we're going to visit about postpartum nutrition and exercise. And then we're going to talk about sex and intimacy in marriage. And all 3 of those really do tie together. So today we're going to focus on your pelvic health. And it's not just, by the way, it's not just for you postpartum mamas. If you're listening to this and you're well past your NICU stay, maybe you're perimenopausal, you can benefit from this too. So I'm really, really excited that this conversation of pelvic health is becoming more prevalent in today's world, that you're hearing more and more about it. And yes, so it's going to be a great conversation. So my conversation today is with Dr. Rebecca Maidansky. She's a pelvic floor physical therapist with over 14,000 hours working in the pelvic health space. She's also a writer and the owner of Ladybird PT, a clinic in Austin, Texas, that specializes in prenatal health, birth preparation, and postpartum recovery. Rebecca's passion is working with pregnant and postpartum to help ease their transition into parenthood. She believes that education, information, and support can ease the physical and emotional pains that arise during pregnancy and throughout postpartum recovery, creating healthier and happier people and parents. And so with that, let's chat. Well, I'm really excited to have a pelvic floor specialist here because while I've had a lot of babies, I know that there always is someone who has great expertise. So Dr. Maidansky, thank you for being here.
Of course. Thank you so much for having me.
Well, I'm curious, pelvic floor physical therapy is not something that I heard about until maybe baby 4 or 5. So I'm curious, I know it took me a while. I'm curious how you got involved in physical therapy initially, but then also how you decided to specialize in pelvic floor.
Yeah, initially the reason I got into physical therapy, I think, is similar to why a lot of PTs end up doing what we do. I had lots of injuries growing up. I played sports. I was in and out of PT a lot myself. And then actually, when I was a little bit older, my mom was in a really bad biking accident, and she broke her spine and ended up with a spinal fusion and was in PT for years and years, and eventually returned to being my skiing partner and my rock climbing partner. And so PT really changed her life, and that's really changed my life. So I think I was always kind of primed to be interested, but I assumed I was interested in more of the orthopedic or sports lens. So that's where I started my career. I started working with ultra athletes, ultra cyclists, ultra marathoners. I was in Northern California at the time. So it was just a really cool kind of like athletic scene. And when I moved to Texas, I was looking at different clinics. And when I was in California, I would see, we would get pregnant athletes and we would get female athletes who would have just different presentations, different complaints, different concerns than somebody who wasn't pregnant or wasn't trying to conceive or wasn't postpartum. So it was always on my radar. And I noticed that at that point, we really didn't have, me and my colleagues didn't really have the tools to support those folks appropriately, which never really felt quite right. And then when I moved to Austin, I started looking at orthopedic clinics and it just sort of felt like it was missing something for me, and I stumbled upon my first pelvic health job and my first pelvic floor boss. And I was talking to her about what I saw in the orthopedic lens and how I really didn't understand why the pelvis wasn't taken into consideration in orthopedic and sports settings. So that's sort of what got me interested. I realized that we couldn't really treat the whole body without understanding the pelvic floor. And once I started it, I really fell in love.
That's so crazy. So my running coach was the one that when he saw me run, he said, "Kathryn, your pelvis is tilting, which tells me that you have a weak core," because I was feeling so much pain in my knees. And he said, "Have you
Mhm.
ever thought about going to a pelvic floor specialist?" So who would have thought that it was the running coach that would have? So that makes perfect sense how they all sort of tie together. So we say pelvic floor, but people may not know what that encompasses. So maybe let's start there. Like, what is the pelvic floor and what all does it entail?
Yeah. So your pelvic floor is really specifically the group of muscles that sits at the bottom of your pelvis. So they're the muscles that go from your sit bone to your sit bone and from your pubic bone to your tailbone. They're the literal bottom of your body, the bottom of your core. And those muscles control your bladder. They have to contract to hold pee in. They have to relax to let pee out. They have to contract to keep gas and stool in. They have to relax to allow you to have a bowel movement. They play a role in sexual function. In men, they help with erections, and people with vulvas, they have to relax in order to allow for pain-free penetration. So they do a lot of stuff, but they're also part of your core. People think of your core as just your abs, but if you think
Mhm.
of like a soda can, that whole thing is a canister, right? Our core kind of looks the same way. It's a canister. And so it's not just your abs on the front, your pelvic floor from the bottom is included in that. So when we talk about the pelvic floor, we really just mean that bundle of muscles, but pelvic floor PTs and pelvic health in general encompasses a lot more than just the pelvic floor muscles.
That would explain why sometimes you have pain in other places, and then when you go to a PT, you're like, "Oh, that solved that problem." I didn't know that.
Anybody who's been in PT knows that where the pain is not always where the problem is. Yeah, exactly.
It's never where the pain is
Yeah.
never where the problem is. I've learned
Yeah, I
that. I'm
think
like,
we upset a lot of our patients with that.
so if a woman is coming to you for pelvic floor, physical therapy, why might be some of the reasons why she comes to see you?
Yeah, so in my practice, we specialize in perinatal health. So we see a lot of prenatal care, a lot of birth prep, a lot of postpartum recovery type symptoms. But that's certainly not the only reason that folks come to us. So if people are pregnant or they are postpartum, we'll see a lot of urinary incontinence, a lot of pelvic organ prolapse, diastasis recti or abdominal weakness, but also pelvic pain. So pain in the front of the pelvis around the pubic bone, pain in the back around the back of the pelvis around the SI joints. That's very typical in that population. Also, C-section scar mobilization or perineal scar mobilization postpartum. But we also have a lot of folks who come to us who've never been pregnant. So we have, I mean, my patients are as young as 15 years old. I don't do true pediatric pelvic health, but I will treat teens through a pelvic health lens. So in younger kids and in younger adults, we see a lot of pain with tampon insertion, pain with gynecologic exams, urinary urgency and frequency, maybe not leakage or maybe leakage, constipation. And then in older adults, we see a lot of symptoms kind of that are exacerbated as a result of menopause. So a lot of a resurgence of urinary incontinence, bowel dysfunction, sexual pain heading into perimenopause and postmenopausal times.
So basically, everyone needs to come see a pelvic floor specialist. I'm listening to you like,
Basically.
that pretty much encompasses not just every season of life, but both sexes as well as just living. Like, it's a huge part of your daily function, and so it can cause a lot of interruptions to your daily life and cause a lot of pain.
Yeah, yeah. I'm a really big proponent of pelvic health as an annual, just the way that, or pelvic floor PT as an annual exam, just the way that we go to gynecologists as an annual exam. I mean, our pelvic health changes massively throughout our life cycle. It changes it changes when we first go through puberty. It changes as our periods and our cycles regulate. It changes when we get pregnant. It changes when we enter menopause, and it changes really at any point in between if there's some sort of injury or trauma to the system. And so, oftentimes, by the time people come to us, I mean, say I'm seeing somebody postpartum, they might be 3 years after their most recent birth, but the symptoms that they come to me often started when they were 12. And so you can imagine how, I mean, when we think about, if your knee's been hurting for 2 years and you go to PT, it's going to take longer to get better than it's been hurting for 2 months and you go to PT. Pelvic health is no different. So when folks come to see us with a 20-year history of symptoms that they may not have even known are symptoms, it takes longer. It takes more work to undo the habits and the factors associated with those symptoms. And if, we can catch things early. And so a lot of my patients who I've seen through pregnancy, I will see once a year just to make sure that, they're how their body's changing and if they're keeping up with those changes and if they're still feeling well.
Well, you answered my question that I was going to ask you in a little bit. But so if you've graduated from pelvic floor PT, you might be a candidate to come back because you might be in a new season. Is that right?
Yeah, I mean, yes and no. I think sometimes when
Okay.
I tell people, like, I think everybody should come to PT annually, that's a little bit overwhelming. Obviously, I'm biased. I do think there's a subset of folks who really benefit from annual check-ins, specifically those with weakness conditions, so like pelvic organ prolapse, stress incontinence. Those are conditions that I liken more to an ankle sprain. If you're a runner and you
Sure.
sprained your ankle in the past, you know that if you don't keep up with your exercises, it'll start talking to you again. Or, that knee pain that you have with running. So conditions like stress incontinence and pelvic organ prolapse, they tend to be like that. It's rare that they go away 100% of the time forever. More likely, we'll get symptoms under control, where we'll understand why they existed in the first place. And then inevitably, you'll go through a period of inactivity. Maybe you'll have an injury down the road that will prevent you from staying active. Maybe you'll have a surgery down the road, or somebody in your family will get sick, whatever it is that will impact your lifestyle that will allow those symptoms to kind of creep back in. So I think for folks who have symptoms like that, it is really valuable to have an annual check-in, or if not an annual check-in, just kind of like a PT in their back pocket so that if something crops up and they don't know how to deal with it, they can go back for a maintenance visit. I know it's how a lot of folks like to treat their therapist. I don't think PT is all that different. But then I think there are other conditions where folks don't really need to plan to come in forever or long term, don't need to continue coming back.
Sure.
So that would include somebody with more of an acute condition, say somebody has a UTI and they start having a lot of bladder pain as a result of that, but it started a month ago and they come to PT for a month and those symptoms go away entirely. That might not happen again. They might just learn the things that they needed to learn to avoid that occurrence in the future. So I really do think that everybody would benefit from the education that a pelvic floor PT can provide. And I think that particularly people with vulvas, there are just so many parts of our pelvic health that our OBs will not talk to us about, that our PCPs will not talk to us about, that other providers just won't be able to talk to us about. But I think that, yeah, I think long-term maintenance care definitely has a role for a lot of folks. Sorry, that was a long answer.
No, no, it was an excellent answer. So if you're pregnant, I know you touched on this. Are there certain things that you can do preventatively to maybe either maintain pelvic floor or sort of reduce the damage and the trauma, even if it's a normal, quote unquote, normal delivery? It's
Yes.
it's a big deal. And then are there things that women can do post delivery that may sort of intercept some big problems that, they could prevent if they were doing some of these things down the road?
Yeah, 100%. I love that you asked that. There is so much that we can do from a preventative lens, and not just for pregnancy, also for menopause. I think pelvic floor PT has gained popularity through the lens of pregnancy and postpartum health, or prenatal postpartum health. It hasn't necessarily caught up to peri and postmenopausal folks yet. Hopefully, I know that it will. It just, we're behind on women's health in general in this country. But there is so much that we can do prenatally to reduce the severity and the likelihood of certain conditions occurring postpartum or in birth. Obviously, we can't control pregnancy. Obviously, we
Right.
can't control birth. Everybody's experience is different. Everybody goes into pregnancy and birth with a different set of risk factors and just strengths and weaknesses. But there is so much that we can do during pregnancy to prepare our bodies for birth and thus to ideally support an easier postpartum recovery. Even things as simple as so many of my patients and so many of my friends, because I'm at an age where I have a lot of friends having kids, so many people don't know that strengthening your core during pregnancy is actually really important. They just know that they can't do the things to keep their core strong that they were prior to pregnancy. So they kind of stop. So that's one really kind of like low hanging fruit. If you stay strong and you strengthen your core appropriately during pregnancy, that can reduce the severity of a diastasis recti postpartum, which is when your six pack muscles separate. It can reduce the likelihood of stress incontinence postpartum. It can even reduce the likelihood of pain postpartum. We have a lot of evidence to suggest that strength training during pregnancy reduces a lot of common postpartum conditions. It doesn't prevent them. We can't do anything to 100% prevent everything, but it reduces the risk and the severity of them for sure. And even from a birth prep lens, I mean, in my practice, we do a lot of push prep. We do a lot of coaching folks how to push effectively, different techniques for pushing, why they may want to utilize one technique versus another. And we see, I mean, evidence suggests that PT support prior to pregnancy and even through labor reduces the severity of tearing, which we know reduces the severity of pain and dysfunction postpartum. So,
Yeah.
yeah, really in every, and I mean, I could go on. There are really clear cases of this for postpartum timelines. Even if somebody's feeling well, there are really clear cases of things that we can do preventatively in perimenopause and postmenopausal times. So, yes, there's a huge, huge space for preventative care here that we're not really tackling.
This podcast is produced by Hand to Hold, a national nonprofit, but we're more than simply a podcast. Be sure to download our app in the Apple Store or on Google Play, or you can visit our website to discover all the ways that we can support you as a NICU parent at handtohold.org. You can join one of our support groups, sign up for counseling, find loss and bereavement support, request a peer mentor, or check out our educational resources and family stories. And all of that is at no cost to you. I think it's important that people hear that it's possible to prevent some injuries or to prevent things from getting worse, because I don't think people know that exists, right? And so I love that you're giving them hope and what they can do prior to birth, but also after birth, that they don't have to live with the pain that they have. It's possible, through coming to see you, just some daily lifestyle changes that they might be able to prevent living in pain chronically for a very long time. So if you're looking for a pelvic floor therapist, like where does one start? Do you just Google your city and pelvic floor? Like, give people an idea of one, how to find a pelvic floor therapist, and also how to determine if they're a reputable pelvic
Yeah.
floor therapist.
So there are a million ways to find a pelvic floor PT. Unfortunately, there are a lot more of us than there used to be. So if you live anywhere near a metropolitan area of any sort, you probably have options. If you live out in more rural areas, it can still be a little bit harder. But where I would recommend people start, especially if they have either an OBGYN, if they're pregnant or postpartum, if they have an OBGYN or a doula or a chiropractor who they trust, who they like, who they've worked with, I would always start by asking for a referral because there are a ton of people doing all sorts of things. And it's really helpful, I think, to have somebody you trust, recommend somebody that they trust. So that if that's an option, I think that is typically the best option for finding somebody who not only knows what they're doing, but also somebody who, jives with the way that you like to be cared for. If you have providers that you like, they probably work with other providers that you like. If that's not an option, there are a ton of locators that you can use online for pelvic floor PTs outside of just Googling pelvic floor PT in my area, which honestly will probably also work. The American Physical Therapy Association has a pelvic health PT locator. You can just Google
Awesome.
APTA Women's Health Locator. There are also a bunch of other listings. Pelvic Guru is another one that has a massive list of pelvic health providers. So really any of those options. But I think the best way to find somebody who I think is a good fit for you, because it's not so much finding somebody who is reputable or somebody who knows pelvic health. I mean, I like to give most providers the benefit of the doubt. If they're doing something that they claim that they're doing and they're marketing that they're doing it, I assume they know what they're doing. But But I think that, there are a lot of pelvic floor PT is really broad. There are people who approach it more through a manual therapy lens, people who approach it more through an exercise lens, people who really buy into different schools of thought. And so it's not so much finding somebody who's reputable, it's finding somebody whose approach you jive with, you align with. And so my last piece of advice would be call the different offices, talk to them, talk to their PTs, talk to their front office, and see which one feels like it aligns with what you're looking for.
Those are good. We'll definitely make sure that we link to all those in the show notes. So thank you for all those. So
Sure.
give people an idea because they may not be aware of what may happen in that very first pelvic floor visit.
Sure.
It's not the normal physical therapy, I guess, visit in the sense that you're in an area of your body that's really tender. So maybe talk through what people can expect if they go to a PT.
Yeah, yeah. So that first appointment, at least this is how it works in my clinic. This is how it's worked in different clinics that I've worked in as well. Typically, when folks come in, they will meet their PT. They'll check in at the front office. They'll meet their PT. Their PT will bring them back to a private treatment room. So that is one way that it differs from a typical kind of like more orthopedic PT if you've been there before. We'll usually start by just talking, and our paperwork kind of primes folks for what they can expect we'll talk about. But typically,
That's
we'll
good.
ask questions about medical history, about what they're experiencing, but also really clearly about bladder, bowel, and sexual health. Because even if you're coming in for, say, pain with sex, you might wonder why we're asking about bladder and bowel health, but it does really help us determine kind of what the global picture of your pelvic health looks like because all of
Mhm.
these symptoms kind of interact with each other. Once we get a really clear picture of what you're experiencing, once patients have had a chance to tell their story and make sure that they feel heard, really, we will plan our physical exam. So typically we'll say something like, based on your symptoms, these are the things that I would like to look at. In most cases, when people are coming to a pelvic floor specialist, there is some reason to do a pelvic exam. So oftentimes we'll look at, a general functional screen. We'll watch you squat. We'll look at your balance. We'll look at your lower body strength. But what we'll look at that your orthopedic PT might not look at is your abdomen, the muscle tone in your abdomen. We might check your abdominal muscles for that separation that I've been talking about. We might look at your breath mechanics and we'll likely recommend a pelvic exam, which isn't done with a speculum, it's just done with a finger. We don't have stirrups. Obviously, that's never a requirement. Folks can always say they don't feel comfortable with it, but it is a key
Sure.
part of our exam. And then from there, we'll have folks get dressed. We'll talk about our findings, and typically we'll send them home with their starter program. So we'll send them home with here are some things I want you to integrate into your lifestyle. Here are some exercises I want you to start doing. And then this is how frequently I want to see you. And then those follow up sessions usually include some aspect of hands on care where maybe we're working on a tight muscle or maybe we're working on stiff joints or something of the like. And then we're progressing what they're doing at home and their exercises and their strength programs or their stretching programs or whatever it is that they have.
No, that's great. I remember the very first time that I went to a pelvic floor PT, I was also starting a workout regimen. And so they were great because I would say these are the things that we do in class, but I think that maybe I need to modify that as I was going for diastasis recti. So 6 babies will do that. And so they
Sure.
were it will. And they were so helpful in saying, modify this until you get to this point and then you can do that. And so it was a little bit of a nice integrated approach that I was wanting to take care of my physical health, but I also knew that I needed to take care of my pelvic floor health. And so, like, to be able to integrate those two was really great. So, I want people
Yeah.
to know that y'all can be such a great resource for other areas that people are trying to improve their core, that there's a way to integrate all of that together. If there's someone, I want to focus on two things real quick, Dr. Maidansky. So, if maybe someone's coming to you and they have either pain during sex or diastasis recti, what what can they expect as far as like treatment goes, or even I guess the end result of therapy? Like, what's a reasonable goal for them to get to? I know that varies from patient to patient, but in general, if someone's coming to you with the separation of the muscles or they're having pain during sex, what's possible? What's not possible?
It really depends on what they're coming in for. So diastasis recti versus pain with sex, obviously those goals are different. But really, regardless of what someone's coming in for, our goal is to figure out what are the things that you want to get back to? Is it
Mm.
what's important to you? Do you want to get back to having pain-free penetrative sex? Do you want to get back to a Pilates workout? Do you want to get back to CrossFit? Right? It really, the plan of care and where somebody will get to will really depend on where they want to go. Generally, I mean, our ultimate goal is to get folks back to doing whatever it is they want to be doing without modification. That's our ultimate goal. However, based on the situation, based on the medical condition, based on the injury, it's not always possible for somebody to go back to exactly what they were doing prior to their injury, their pregnancy, their whatever, because as our bodies change, as we experience different things over time, sometimes we do need to modify moving forward. So if getting back to exactly what they were doing previously and exactly what they want to be doing isn't necessarily achievable right now for whatever reason, we also make sure that we are figuring out like, well, why is it that you want to get back to this thing? And if we can't do this thing right now, what is something else that we can do that will feel equally as impactful to you and equally as beneficial? So I'm specifically thinking of a patient that I have who had a pretty severe diastasis recti. She had about a 5 finger width separation. And she was a competitive CrossFitter. She would compete in competitions for CrossFit. She was extremely strong, extremely athletic. But she would have an exacerbation in pain whenever she pushed beyond a certain limit. And so her goal was to compete in a competition by February. And by January, it became apparent that she could certainly do that, but we would likely see an exacerbation in symptoms because she'd be pushing her body beyond where she's currently capable of maintaining that form and that strength and that support. And so sometimes those are also the conversations we're having. Like you can do this thing. I'm not the one who gets to decide what you do with your body and your time in your life. But I do think it's my responsibility to make sure people are making an informed choice. So she's planning on competing in February and I fully support her. I mean, if that's worth it and if she doesn't mind that exacerbation and pain and we can manage that after, then that's a perfectly appropriate choice. So that's what goals can look like in the best case and I don't want to call it the worst case, but in the alternative situations.
Well, and I think it gives people an idea of the conversations that they can have with their PT to say like, "Hey, this is a goal of mine, what's possible, what's not possible." And then, like you said, making an informed choice based on their life and what it is that they desire, but making it not just based on how they feel, but a conversation with you and whoever their physical therapist is so that they can get to a quality of life that they're happy with, that
Yeah.
it's not just you giving them a list of exercises and then going home and doing it, and then there's not really any interaction after that. So I think that's really helpful for people to hear that.
Yeah, I mean, it's very much a partnership. PTs are experts in certain things, but our patients are the experts in their own lives and their own bodies. And so it's not that typical doctor-patient relationship where a patient show up and then we just tell them what to do. It really is this collaborative approach where we get to talk about the goals and talk about the why behind the goals and help people make informed choices.
Well, you've got me thinking. I'm like, I think it might be time for me to come back to um, my pelvic floor PT.
I
But
call up
yeah,
your
we
PT.
well, I mean, we all hit different seasons or things change, and you're like, you know what? I'm not getting any younger, but I want to be stronger and I want to have a great quality of life. And these are some things that we can do to make that happen. So, Dr. Maidansky, if there is a woman listening to this and she's given birth and she is anxious about coming to therapy for her pelvic floor, what would your encouragement be to her?
Yeah, I would just say that you never have to do anything that you don't want to do. And pelvic floor PT can look a million different ways. So if you're worried it's going to hurt, your PT can always go slower. If you're worried about a pelvic exam, we can always not do that. And so if you have a fear and that fear is what's keeping you from seeking care, what I love when people do is when they reach out to us and they say, like, this is my concern. This is why I haven't reached out before so that going into that session, I know that this is what we're walking into, and I can be sensitive to that and ask questions and make sure that we're moving at whatever pace a patient needs. So you're certainly not alone if you're nervous. We hear that all of the time. And also, pelvic floor PT can look like anything. We can make progress really with any amount of, I'm trying to think of the right word. We can make progress regardless of what it is that you are or aren't comfortable doing or aren't capable of right now.
That's such good advice. If people want to learn more about just like pelvic health in general, I know that y'all have some great resources. So maybe share with folks where they can go to find all those resources. And I know, like I said, we'll definitely link to all the places that you mentioned to finding a good fit for you and your body for physical therapy in our show notes.
Yeah, absolutely. You can find, I mean, we have tons of information on our blog. If you go to ladybirdpt.com/blog, we have endless articles about what PT looks like, what PT for different conditions look like. We have a lot of content on Instagram and YouTube as well. Our Instagram is ladybirdpt and our YouTube is ladybirdpt1. So if you want information on what PT looks like, what PT for different conditions look like, what kinds of things we treat, you can find tons and tons of stuff there.
Well, that is how I found you. So it's outstanding information. I love it. And thanks so much for giving us some encouragement in a place that sometimes we often neglect. Well, I mentioned in my interview with Dr. Maidansky that I had been the recipient of pelvic floor physical therapy, and it kind of changed my life. Okay, it didn't kind of change my life. It really changed my life. And I'm such an advocate for physical therapy. I have a crazy back. I've got a bad knee, like all the things that, you're like, I got to go to a PT for that. And PT changed my life. And I knew because it had changed my life with my back and my knee that maybe it could change my life when it came to my pelvic floor. And indeed, I was right. So in today's 2-minute take, I just want to reiterate what Dr. Maidansky said at the end, that it really is for anyone in any season, any stage of your life, that going and finding out, hey, this pain or this thing that I'm dealing with is hard and it hurts and I want it to be better. What's my goal? I love that she mentioned that it's not just for postpartum mamas, but that it can be really for anyone. So certainly if you're postpartum, you are high at the list of how it can benefit you. But I feel like what a great thing to know that your pelvic floor can benefit you for the rest of your life. So don't be afraid to call them up and go see them. It really can be a game changer. And, someone that you trust, I think I just Googled in Austin, I think at that time there was just one PT place here in Austin, but I think OBs are becoming more well-versed in who's around, who's available, as well as just your good friends to say, hey, do you know of someone? Who can I go talk to? And then building that relationship of, do I trust this person? Do they understand my goals? And are they going to help me get there? There are so many great resources. We're definitely going to link to all those in the show notes. And I want to say this. You do not have to live in pain. Okay. Your sex does not have to be painful. Living doesn't have to be painful. Going to the bathroom doesn't have to be painful. Having a pelvic exam with your OB-GYN does not have to be painful. So there are resources out there that can help you tend to yourself. I know I had 4 regular births and I had an emergency C-section, and then my last birth was a VBAC, so vaginal birth after cesarean. So I did it all, and that whole core of my life took a beating, and I think I just waited until my 6th baby to address the help. But how wonderful to know that you can address some of that perinatally, so you can prevent some of those things. And then if you do have pain, if you are struggling, there are ways to deal with that so that you can live a productive, healthy, and pain-free, or certainly less pain than what you're currently dealing with today. So don't go anywhere, because the next time we're going to be talking about this.
I think I will always come back to mindset first. Let's start with our mindset, because slow progress is still progress. So you may not be able to, move in the ways that you were moving beforehand. However, no progress is no progress. Slow progress is still progress. And so even just starting in that mindset, heart set space of something is better than nothing. So even if it just means that you sit up in bed that day and that's as far as you get, let's sit up in bed two times tomorrow. If you're a little bit more able than that, great. Let's walk around the unit one time.